Okay, I'm gonna go through the steps and processes of opening your field and how this competency is gonna look, okay? So the first thing I'm gonna do is I'm gonna come into my OR and I'm gonna check my furniture, and I'm gonna arrange my furniture how I need it for that case, based on where the surgeon's gonna stand, where I'm gonna stand, and I'm gonna arrange everything. I'm gonna make sure my equipment's ready, and then I'm gonna damp dust. So first thing in the morning, we always wanna damp dust our OR. Once I get all that done, then I'm gonna open my field. So the first thing I always do is I open my back table. So for the competency, what I'm gonna want you to do, because we reuse these, you're gonna look at it and go, I'm checking the integrity of my package. Once you've done that, then you can open your field. Now keep in mind, you can move this table, it has wheels, okay? So this, I'm just gonna kind of grab this cuff here, and I'm gonna pull and drop. And then I'm going to use my foot to kind of push it that way so it doesn't get over my mayo. And then I'm going to pull this side and we'll do the same thing. Pull and drop. And then I'm going to reach down here and I'm going to slide my table back over where it needs to be. Okay, from there I'm going to open my basin. I'm going to pull it over here so you can see it. The first flap, I'm gonna push, pull, tug it and away from me. You never wanna reach inside, so I'm just gonna grab this corner, pull, this corner, pull, this one, kind of give it a tug, and do it like that. And I'm gonna go over here and I'm gonna marry it up to my table. So it's gonna look like this. Let me turn the camera for you. It's gonna look like that. Basin, stand, okay? Now, because I refolded my gown, the next thing I would do is open my gown. Mine doesn't look that fancy because I refolded it and it was a little hard to do. So now I'm going to go ahead, I'm gonna open my gloves. Those I'm gonna put on my back table because I already opened them. These long ones can sometimes be hard, but you guys have done really good with them. You don't drop them like that. Okay, just like that. I'm going to open my pan, so I'm going to check the indicators on the end to make sure they're good. I'm going to pop it and walk away. I'm going to check this inner filter on the lid. I'm going to look at it and say it's good. I'm going to set this aside. And then I'm going to look for my chemical indicator, and I see the chemical indicator. Now I'm ready to go scrub. If there were additional items I need on my field, if I needed things like suture, surgeon's gown and gloves, anything like that, I would flip that onto my field at this time. So now I would go scrub. Okay? So I do my scrub, I come back, I would pick up the towel and I would bend at the waist so that I can dry my hands without the towel touching my scrubs. Then I'm gonna reach over to the book bind and I'm gonna pick up my gown. I'm just gonna pick it up and open it up. Now, yours is gonna look much better. Open it up. What we never do is we never walk between two sterile fields. So this field is open and my mayo stand's open. So I'm gonna put it there and I'm gonna reach over here and I'm gonna open my gloves, and a circulator would come behind me and tie up my gown. Okay, thumb to thumb. So here's my thumb. I'm gonna lay it against these fingers so I can feel my thumb. The fingers are facing me. And then I'm just gonna open these gloves and flip it around. Never exposing that white cup. So I'm gonna pull this sleeve a little bit And I'm gonna pull the glove a little bit, because you can see, if you can see on the camera, my white cuff is all wrinkled up in here, okay? So I'm gonna pull a little bit here, pull a little bit. Now I've kind of got that cuff where I want it. Jenny, can you tie me up? Now I'm gonna do the same thing, left hand, thumb to thumb, and flip it over. The one thing I don't want you to forget is to spin. So at this point, I'm gonna spin, because my circulator's now in the room. She's already checked on the patient. I take the left tie in my left hand. The card in my right hand, I'm touching the blue. I'm gonna hand it to my circulator with the white. And then she can spin or I can spin, as long as I don't contaminate. Then I'm gonna tie. The next thing I'm gonna do is I'm gonna dress my mayo, because I need as much space as possible for my items. So I wanna make sure and set up all my sterile fields. So orient your mayo cover on the back table before you approach your mayo stand. So I'm gonna get it fixed to where I can get it right on there. And I'm gonna be mindful to not to turn my back to that field if it's too close. So I'm gonna take this on the mayo and I'm gonna scoot it on here, putting my foot on the foot pedal. And then I'm gonna push my body up against it so it doesn't fall. If it falls, it's contaminated. Once I get it started, then I can just start pushing it on there. Now I can marry it to my field. Once I've draped the mayo, I want to go ahead and finish my mayo, so I'm going to grab 2 towels to reinforce it. Turn the mayo. I'm going to turn the mayo again, because then I don't have to move. The mayo moves. It has wheels. Use them. Now my mayo's dressed. So now I have another sterile field that I can put things on if I need. The next thing I'm going to do is I'm going to reinforce my back table with this 3/4 drape. So I'm going to open it up just like this, open up this side, and then I'm just going to push the corners so my hand doesn't drop below the tabletop. And then I'm going to get my instrument pan. Then I'll reach in, I'm going to pick it up. The circulator comes over, she checks it before I put it on my table. You have to get the circulator while they're in the room. They're busy. Perfect. Now I can set this on my table. So since I've got my pan out, I'm going to go ahead and make my roll towel. So the roll towel, you want to be about the same length as your stringer. So I'm going to take this and I'm going to roll this up, and you want it tight. Now, when you're in the field, sometimes you'll have a paper bag, or you can use this that your instruments come in to roll it up to make it tighter. Okay, now I've got that. Now I'm going to take the stringer out and I'm going to lay it on my roll towel. When I lay that on the roll towel, I always put my hemostats towards where my sharp zone is going to be. So I know what surgery I'm doing. I'm going to put my sharp zone, my neutral zone right here. So I'm going to go ahead and put my knife blades there, or my knife handles. And then I'm going to arrange my forceps or my pickups by toothed and non-toothed. So I got non-toothed over here, and I got toothed over here. Okay, and then I'm gonna arrange my retractors the same way, so I may just take them out and hold them so I can arrange them how I want them. So I'm gonna take my wheat laner, I'm just gonna stand him up there in the corner just in case I need him. My Army Navies together. And there's my Sin and my Parker. So I'm just gonna put everything together. Richardson, Richardson, and then my Richardson Easons. Now, everything is where I can visualize it and my circulator. So when I do my count, my circulator can see everything I've got. I'm gonna continue setting up my field. Here's my needle box. It's gonna go in the sharp zone. Remember, we're trying to move everything one time. Bovie, I'm gonna need to throw that off when I get to the field, so I'm gonna put it right on my Mayo. Here's my sponges, Ratex. Here's my laps. Here's my basin for irrigation. I have this basin. I'm just gonna sit it over here because that might be where my specimen goes. Again, touching things once. Suction, I'm throwing off. I'm throwing that off. There's my Hypo Lure-Lock syringe. There's my marking pen. A ruler if I need it. Again, I've got sponges. It's part of the sponges, so I'm gonna put that there, and I'm gonna put my kidney basin there. Could be also something I use for a specimen. Here's my aseptic. Okay, so now I've got my field set up. The only thing I would need to add would be sutures or anything else additional I need on the field. Now I'm ready to count. I'm gonna do my first count, which is done pre-operatively, okay? So I'm gonna start with my softs. When you count, you want to completely separate them so your circulator can see. 1, 2, 3, 4, 5. 5 laps. They'll write it on the board. Ratex. Okay, so I'm gonna do my Ratex like this. I'm gonna fold them in half and I'm gonna say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Peanuts. 1, 2, 3, 4, 5. Softs are done. Sharps. I've got 1 Bovie tip and scratch pad. I've got 1 suture, and I've got 1, 2 blades. 1 Hypo needle. Okay, now I'm ready to count my instruments. I'm gonna start with the stringer first. So I'm gonna take this knife handle and I'm gonna put it on the tips, and I'm gonna say 1, 2, 3, 4 mosquitoes. The circulator has the count sheet, and she's gonna go through as I'm counting and correct and make sure that what I'm counting also the count sheet says. 1, 2, 3, 4 hemostat. 1, 2 Kelly. 1, 2 tonsil. 1 right angle. 1, 2, 3, 4 Coker. 1, 2 Alice. 1, 2 Babcock. 1 sponge stick. 1, 2, 3, 4 penetrating towel clamps. 1, 2 non-penetrating towel clamps. 1, 2 Webster needle driver. 1, 2 Mayo Hager needle driver. 1 straight Mayo. 1 curved Mayo. 1 Metz. 1, 2 knife handles. Pickups or forceps. I've got 1, 2 DeBakey. 1 smooth forcep, dressing forcep, whatever you want to call it. 1, 2 adds in with teeth, and 1 rat tooth. Retractors, I've got 1, 2 Parker, 1, 2 Richard Eastman, 1, 2 Sin Sharp, 1 Army Navy, 1 Wheat Laner, 1, 2 Army Navy, 1 Wheat Laner, and 1 small rich, 1 large rich. My count is complete. And that's how you set up your field.